Good afternoon and welcome to another edition of Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming also on Facebook Live. As usual, we have in the studio with us Dr. David Jetmore, Wayne County Health Officer, bike rider, the guy who prayed this weather to us today. Nice job for a fall day.
This is a motorcycle riding day, Eric. And
My
anyone
man.
who has a motorcycle should go out and jump on it right after the show's over, but not before.
Okay. Dr. Thomas Huth, Vice President of Medical Affairs at Reed Health and superstar on WHIO Wednesday evenings at 5 o'clock on their news
Not
program.
quite yet. We're working on it.
Working on it. Okay. How are you?
Very good. Having a great week.
Cool. Before we get with them, I know this is not a political show, but voting has begun. And I know, Ryan, that there's no slide that you have for this, but I do want to remind people to get out and vote. Registration has ended. You can't do that. It's just about getting to a polling location, and you can do that. The voter registration office at 301 East Main Street in the courthouse is open Mondays from 8:30 until 5, Tuesdays to Friday, 8:30 to 4:30, Saturdays on October 24th and October 31st from 9 a.m. to 4 p.m. Last day you can do that in those locations are November 2nd. Oh, thank you. And also, absentee or early voting is going to take place October 26th through October 31st at the Coleman Center, Golay Center, First English Lutheran Church, and Hagerstown Testament Church. And then Election Day, Coleman Center, Golay Center, Mount Olive Baptist Church, First Baptist Church, First English Lutheran Church, New Testament Church, Life Spring North, and Centerville Christian Church. Voting is a very important part of what happens in this community and throughout our country, and we really want you to take advantage of that. So let's turn to our doctors and find out what the week has been like and what they know new before we go to our guests. We do have a couple of guests on Zoom, Denise Retz and Keith Clemens from the Parks Department. We'll get to them in just a few minutes. You're fired up. You're in red today. Let's start with you.
Well, I have a red pocket square on me.
Yes, you do.
You look very
looks
dashing.
sharp.
It kind of stands out because I don't have any other red on me. But, so if I ever show up here without a pocket square, I want you to query me on that because I'm trying to remember to do that. I am told that a gentleman always wears a pocket square if he has a jacket on, so I'm trying to...
Vests don't count, right?
Your vests don't count.
Cool.
But as far as what's going on this week, we've had a really busy week. I participated in a national webinar for health professionals to talk about some things related to the impact of COVID-19 on the business of healthcare, and there were a lot of people tuned into that, so that was fun. That's just a personal note. But as far as what's in the news, of course, there is the fact that President Trump got better very quickly from his episode of COVID-19, and
I hear we're all going to get that cocktail for free soon.
Well, and that's why I brought that up, because it wasn't really much remarked on at the time, but I think one of the key treatments he had was Regeneron's candidate monoclonal antibody treatment, which is basically a laboratory manufactured neutralizing antibody that is in phase 3 trials now, and he received that as a part of their. He qualified for their study, so he received that, and I think that was probably one of the key things that helped him improve. I noticed that hydroxychloroquine was never mentioned as a part of his treatment regimen, which is probably for the better. But he also received some dexamethasone. He also received remdesivir, so he got kind of that cocktail. But the key difference was the monoclonal antibody, which I have been saying really for a long time that is probably something that has the prospect of making a big difference, at least in terms of the acute treatment of COVID-19. And the sooner we can get that out, I would like to see that happen even quicker than vaccine, if I'm being totally honest. And others, Dr. Fauci has been predicting that would be the case, and so I've been looking for that. And it just happens that this week, Johnson & Johnson's version of monoclonal antibody, they're done with the phase 3 testing on it and are pushing with the FDA to get emergency use authorization as quickly as possible. And I think that that will be a very key thing in terms of turning COVID-19 from a possibly deadly disease in certain subgroups of people into something that's a lot more like the treatability factor of influenza. So there's that. I think that's a key thing that isn't too much remarked on, except that President Trump did get some notice by his tweeting that he wanted to make that available for free to everybody. Then another thing that's of importance in sort of in this week's news is really just more locally, and we can talk about that later, the fact that we're having some little focal, but I think in some respects related outbreaks. And so our numbers are not looking as good as we would like. And I think there are some key differences in the way the numbers look that we'll point out when we get to the point of talking about the data and the graphs. It'll be very apparent that this is very different.
We'll bring those up earlier in the show this week so that we can kind of start that conversation and let you all have that. Dr. Jetmore, what's new this week with you?
Well, we're headed in the wrong direction. Our positive cases per day has almost doubled in the past week. I mean, we're going along at about 10 to 12 cases a day. Yesterday we had 24, or the day before yesterday, 24. Yesterday, another 24. We've had 98 cases since we last had this show. So we're heading in the wrong direction. I think this is due to a number of factors. I think cool weather is probably a factor, although it's freezing in the morning but warms up in the afternoon so you can ride your motorcycle, as we mentioned earlier.
I got to get me one of those.
But there are a lot of people are this epidemic is caused by a virus, but it's behavior driven, and I think a lot of people are letting their guard down. We've moved into governor's phase 5, and for a lot of people that means it's over. Well, it's not over. We still need to socially distance and wear face masks, and that's the main protection we have to keep from getting this disease, along with hand hygiene. But we've had some clusters where people have gathered from churches and large gatherings. The schools have done a good job with the epidemic. We have when a student does get come back positive, though, we have to take all of their close contacts out of school, and sometimes it's an entire cohort of people out. I guess one of the things I should talk about, was Halloween, but with our guests, I can probably defer that to them. I do want to announce, I talked to Christine earlier, and she said that we've got 4 flu clinics coming up. The first is on October 17th at the Centerville Abington School from 10 to 1. On the 20th of October, we have one at Western Wayne Schools from 4 to 7. On October 22nd, we have another flu clinic at the Hagerstown Elementary School from 4 to 7. And then lastly, on October 24th, we have yet another flu clinic at the Seton High School from 10 in the morning till 1 in the afternoon. So I wanted to get that in. But I'll defer any comments about Halloween until we talk to our esteemed guests.
Okay, hold on to that list. I'm going to ask you to run through that again for me because we don't have it. I know it's fresh, so we don't have slides to bring up. So before we get out of here, I'm going to ask you to run through that one more time. You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live. It is not live, but it is also available on TV3 in Connorsville, and we continue to appreciate their support. Speaking of Halloween, let's kind of go there. There are events that are taking place. The mayor has said that at this point in time, he expects that we're going to have trick-or-treating the way that we normally would and that type of thing. The Parks Department for years has always done a great job with Halloween events, and they're planning on holding some. We want to find out what it is they're going through. You're both talking about seeing numbers go up. And you've both talked about, though, wanting people to get out and do things. that it is possible to go. You went and played golf. You were talking about being at a wildlife event or something along those
Yeah.
lines. It is possible to go out and do things. Want people to do it safely. The Parks Department, I think, is trying to do that, but we're going to find out. So if we've got them on Zoom, Denise Retz and Keith Clemens from the Richmond Parks Department, thanks for joining us today.
Thanks for having us.
Thank you.
Denise, let's start with you. What do we
Okay.
need to know? You've got is Halloween your next big thing coming up, or do you want to mention one or two things that are happening even before that?
Well, actually, Eric, it's great to be here, and hi, doctors. We've been working with event options for quite some time. We've been safely providing the farmers market since the 23rd of June. And that's considered a major event for us on the weekends. So we've been working through that effort and, making that as safe as we can. Masks are required. Hand washing stations are put out. Hand sanitizing stations are put out. We have strict restrictions for our vendors on handling produce, handling goods, as well as handling money, and the safe distance between the vendors and the customers. So we feel that essential market and that service for local food access has been really great, and the community has loved having that as a safe grocery option. So this is not something new that we haven't not been doing in terms of providing safe events, but Keith is actually working on our Halloween event as our community recreation coordinator. And he put together a pretty great plan with capacity limits and guest info and the mask requirements. But what we're going to do is we're gonna shut down Glen Miller Park. We're going to make sure that the actual parking lot is safe. And we're going to have 3 different stages of parking, and then we're going to close everything off so we can have 150 acres of space with several nonprofits so that kids can come around and safely trick or treat here in a specific area with our friends and our partners. We could, obviously we'll still have the trick or treat night 5 to 7. October 31st, but we encourage people to come out to Glen Miller and safely trick or treat here. Wear a mask. All of the nonprofits will be required to have gloves on, and we will be handing out candy, and police and fire will be available, and they'll be also handing out prizes for costumes and fun things like that. Keith, do you have anything to add on this fun event?
You've covered a lot of it. I know we've worked together a lot in the past few months here about trying to find some way of getting events going on that's people feel safe to come to, and I think this is a good way of spreading people out while still having everyone together. We're using a lot of the park, everywhere from the band shell to the playground. So there's a lot of room to spread out, even if you have to go to one spot to get candy. There's still plenty of space between to spread out between things. And then there's a big pond in the middle to really keep people from congregating in one spot or another. We've kind of looked at a lot of different options, and I know we've had a lot of people come to our past Halloween events out of the Tom Raper Center. Showed a lot of support. So we're hoping to weather might be a little bit of a factor, but we're looking to get people outside and get out and do some stuff that they might not be able to do elsewhere.
Okay. See if the doctors have anything they want to throw in here.
Sure, I'll go first. Hello, Denise.
Hi.
And is it Keith?
Yes.
Yes.
I'm sorry, I've not met you, Keith. Nice to meet you virtually.
Nice to meet you.
A few weeks ago, there was a little splash in the news with the news reports kind of truncated the feedback from the CDC about holidays as saying CDC says don't do Halloween was essentially the message. And of course, if you took the time to actually read what the CDC wrote, it's a little bit more nuanced than that. Basically what they're saying is they were saying Halloween as we have traditionally known it should possibly change and not be done strictly according to how we usually would do Halloween. I noticed that they had guidance in there for things like having, instead of having kids come up to doors, maybe have a table at the end of the driveway with trick-or-treats lined up, and they can just walk by and grab and go, so there's no bunching up of people. Is that the sort of thing that you're looking at with your Halloween plans at the Van Miller?
To an extent, yeah, it'll be a stop. We will let the different organizations hand out candy, but we're actually ordering a bunch of Halloween bags and stuff like that they can drop right into children's candy bags or whoever's trick-or-treating into their bags. So there's no contact there whatsoever. It's not going to be I've seen some things both ways that they say, grab things off the table, but also don't do a grab bowl where kids are reaching in and grabbing a bunch of things. And so it's kind of a mix of both. We think the individually wrapped candy coming from a reliable source, a safe source, can be just as effective as, a random table on the side that, you don't know how many people have been touching.
And we will leave it up to the organizations to do what they feel comfortable. And I think that's what's great about this Halloween Trick or Treat in the Park event is that people can come at whatever comfort level that they have. Just meeting those requirements of wearing the mask and safely social distancing and going from organization to organization, I think will be great. So we'll have people set up in our shelters. We'll have people set up at the playground. We'll have tents throughout. We'll have trucks, fire trucks, police cars, things like that, also helping make sure everything is safe. And we welcome the community to participate.
Well, Denise, this is Dr. Jetmore. The Parks Department always does such a great job. I think none of these events can ever be perfectly safe. Your whole goal is to make them safer, as safe as they can be. The one thing about Halloween is it's, the one holiday that's almost always celebrated outside, which is a safer place. You've got a greater volume of air. I think cautioning people to wear masks and to socially distance lets us do many of the things that we've always done on Halloween. And I think the other thing that families need to think about, there's a lot of things you can do as a family. You can carve pumpkins, you can put up Halloween decorations as a part of your own personal celebration of Halloween. But I remember, thinking back as a kid, and there's still a 9-year-old boy inside of me, Eric, I like to go out with a mask on and, by gosh, panhandle on Halloween. We called it trick-or-treating, but it was actually panhandling. And these kids, they've been through, their little lives have had total upheaval since the onset of this pandemic, and it would be so great for them to safely, or as safe as we can make it, for them to be able to go out and trick-or-treat. And I think with these guidelines, we can have a pretty safe Halloween. Do you have any more comments to the deluge of comments I've made, Denise, or Keith?
Well, we appreciate the Wayne County Health Department's lead on their support on this event. We have discussed this with both Dr. Jetmore and Christine, and the mayor was quite excited about potentially having an event again within the city that we can invite our community into, and doing this safely. And so we're all very happy to be able to provide something like this with the Wayne County Health Department support. So thank you so much. And we also have a few other things that will be coming up that we'll be working on safely as well, like the Veterans Parade on the 7th of November. And we'll be working through that. We got approval to move forward on that event as well from the Wayne County Health Department. Thank you. And then we also have our Winter's Farmers Market that will be starting that same day on the 7th. And we'll be doing that as safely as possible too, including having another home for the holidays, we like to call it, at Star Jeanette. We'll be winterizing that facility and making sure that we can have proper social distancing with our vendors and in an outside type environment. So that'll be much safer than the senior center that we were at last year. And we're excited to continue to move forward and keep everything safe for our community to participate and also get their grocery in an essential, safe way. So thank you for all of your support.
Are you, it's a little muddy for us in the studio, but did you just say that the indoor farmers market is going to be moving?
Yes, we have. Sorry, if you can't hear me, I can try to talk a little louder, Eric.
No,
You know,
it's just our speaker in here. You're good.
I can scream. No, but we'll be moving from the senior center to the Star Jeanette area. We feel that's a safer option for our vendors as well as our patrons, and we can spread out there and provide basically the same atmosphere as we are outdoors with Elstro down in the Star Jeanette building. So we're working on winterizing that facility to make that happen starting the 7th of November, so we can continue that essential service.
I saw something come up over your shoulder, and I assume you put it there, not us, about the Veterans Parade. Is there? Okay, Ryan put that there. What can you tell us about the Veterans Day Parade?
So the Veterans Day Parade, I'll take this one. We're going to do it again, kind of like we did last year. We can go back down Main Street. We just got approval last week for it, so it's still in its infant stage of kind of development. But we're looking to keep it down Main Street. Unfortunately, we won't be able to have the grandstands and the speaker, just because that's going to bring too many people to one block. We really want people who come to celebrate it to spread out. The veterans and the people in it are high risk in this community for the COVID, and so we want people to really respect that and try to spread out along the city. It's going to be hard to really keep people honest about social distancing and wearing masks. Everyone in the parade will be wearing masks, and the groups will be spread out a little bit more so that they are not passing it along to each other. But we do have to ask the public to help us out a little bit and kind of police ourselves, as well as the people who are running the event. There's a lot going on in a short amount of time for a parade, but we are looking to. We're going to have it on November 7th. It's going to be at noon on that Saturday. So it should be a great event, and we are now taking applications to be in it as well.
Okay. How do they get the application? Where do they need to go, Keith?
They can come to our Facebook page. It should be on our city website here shortly. And if you've been in it in the past, you'll be getting an email from me today as well. So there's a lot of different ways, or they can call 983-727-7475 at the Parks office, and we can get them an application there.
Okay.
Absolutely. And we were able to choose our we had a nomination for our Grand Marshal, and that will be Roger Stinson. He has worked tirelessly in his efforts with the Veterans Park and also Veterans Organization. So we do have a Grand Marshal, and that's very exciting. We have already had a couple meetings here, and we're on our way.
All right. Denise, if you want to give us real quickly one more time the rundown on your Halloween event, just so that we have it one more time, what people need to know.
Absolutely. We will shut down the park. We'll have 150 acres of fun. You can come and explore Glen Miller and safely acquire candy at the same time. And that is October 31st from 5 to 7. The organizations are, you can call 983 Park, and any nonprofit organization is welcome to participate. We have plenty of space. We ask that they bring the candy and also practice all of our guidelines. And you can do that and register with Keith and call here, and we'll get you all set up. But we will ask all of our community to come and participate and have fun, and we can do this together.
Okay. Denise Retz, Keith Clemens from the Richmond Parks and Recreation Department. Appreciate the time. Appreciate the work that you're putting into trying to keep everybody safe so they can enjoy Halloween.
Thank you.
Thanks for being with us. You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live. We're taking your questions on our Facebook Live page, also on Twitter at WCTV Info. There's some things we're going to get to. Let's go with a couple of questions first, and then we will get to the numbers. We want to get to those earlier, particularly because you both mentioned we've got a spike in those numbers, so we want to talk about that. So let's get the first question up if we can. Is the virus still mutating? Do you know how many variations or mutations currently exist and how this might affect a vaccine?
I will take a first step at that. In fact, the virus is still mutating. In fact, I was looking at a website that kind of catalogs all the variations, and there are something over 3,000 major variations of the virus so far. Those families of variations of viruses are called clades, C-L-A-D-E-S, and there are over 3,000 of them now. The question is how widely do they vary, and can they vary enough that a vaccine will not cover, extensive variations of them? And that's so the individual who asked this question is very smart and is really asking the right question. And that's the question all the experts are asking themselves, and that's part of that's one of the factors in whether a vaccine that may have been developed for an earlier an earlier version of the virus, whether it will be for later versions. We do know that there has been at least one mutation that has significantly affected the virulence of the virus. It's called the D614G mutation to the gene that controls a characteristic of the spike protein on the virus that simultaneously seems to have made the virus a little bit more easy to spread. It's more sticky to the ACE receptor, but also seems to have reduced the virulence a little bit and may partly explain why, as time has gone on, the severity of the illness seems to have decreased somewhat. That's given us this pattern in the case numbers where we have actually more case numbers now than we ever had, but much lower need for hospitalization and many fewer deaths. So the D614G mutation is a great example of that. That mutation probably does not impact the ability of a neutralizing antibody to disable it, fortunately. But who knows what future variations of mutation might impact the success of a vaccine to reduce infection. And that's why, this is what happens with influenza viruses, right? That's why we don't ever have just one vaccine that gets rid of influenza once and forever. There are multiple variations. The vaccines are partially effective. There can be enough mutation in a virus from when it was in the southern hemisphere to when it's in the northern hemisphere that the vaccine that was developed against the southern hemisphere samples doesn't completely reduce the infectivity or the susceptibility to infection in the northern hemisphere. So it's a constant struggle that has to be constantly adjusted to. And I think there is an expectation that that's the way it will be with COVID-19 as well. It will probably settle down into more of a cyclical pattern with new versions of vaccine that will need to be developed from time to time to make it, to be able to change with the virus to make the vaccines more effective.
Just as an addendum to that, the questioner asked if the virus is still mutating, and that's kind of the MO of viruses. They're always mutating. There is some good news in that this particular COVID virus only mutates about 20% of the rate of the influenza that we see every year. And as Dr. Hughes said, that's always a problem when we have our vaccine for influenza in the fall, is how effective is it going to be? So a virus that mutates at a lower rate, it bodes well for coming up with a vaccine that will be effective. Viruses, as a general rule, always tend to become less virulent as they mutate.
See if we can get a couple more in before we go to our numbers. Next one up, are seriously ill patients being transferred to Indianapolis for care?
If you mean from Reed, they certainly have been. I can't name for you when was the last time. It's not a very common occurrence, especially now lately. I think we have much more success of and in our ability to manage patients successfully here, but we have occasionally had very serious ill patients who would benefit from services that we don't provide here. And the biggest example of that would be a treatment called ECMO. That's extracorporeal oxygenation.
Mechanical oxygenation.
ECMO, yeah, mechanical membrane oxygenation. Extracorporeal membrane oxygenation. And it's a mechanical process to oxygenate the blood that basically bypasses the lungs. And we have, I think on maybe 2 occasions, sent individuals to Indianapolis, which is where there are ECMO machines, and there are not a ton of ECMO machines in the state of Indiana because it's not a very commonly needed therapy for anything, but we have occasionally done that. And that would probably be the main example, and I think it's been a good while since we've had to do that, but we have done.
Okay. Next up. Does diagnosing people as unknown virus versus COVID-19 make controls of COVID spread less effective? We'll leave that one up for a second. We'll let them read that.
I'm not sure I understand this question.
So I think I have, if we're unable to definitively pinpoint COVID-19, maybe this is the question, does that make controlling COVID-19 more difficult? In other words, if we have patients who maybe are getting clinical diagnosis, maybe they've had negative tests, but they're still suspicious, as they might have COVID-19, they might not. And so a judgment call is being made. Does this patient have COVID-19 or not? And we lean one way or the other. Might they elude, might an actual COVID-19 case elude the contract to control mechanisms? I think that's basically the question, if I'm reading it correctly. And I guess there always is that risk. But I will say the advice that's given to patients with any viral illness these days is still to take it seriously. They're all advised to stay home until they're feeling well, that they've been fever-free for a certain period of time, that their symptoms are improving, and if possible, work from home through the full, basically quarantine or isolation period that you would normally do for COVID-19. Even if they've tested negative and there's a suspicion that COVID-19 could actually still be the case, they kind of get treated much the same. In fact, if they get labeled as a clinical case, then they still go through contact tracing, I believe. Is that not correct, Dr.
Mm-hmm.
Jetmore?
That's true.
So I'd say the risk of losing control of the spread of the virus for this reason, I guess it's there, but we take steps to minimize that.
Okay. Let's get one more in, and then we'll go to the numbers. If someone who has tested positive and been healthy for a few months is now exposed again, what are their protocols for quarantining? Are they immune?
Well, I'm not sure. Tom may know the time factor. The CDC, I think, recommends that they don't have to be tested again if they're a contact, if they've had COVID within a 2-month period. The evidence is, the clinical evidence at least, is that people who contact COVID are immune. The question is, how long are they immune? Because studies have shown that the antibody levels in 80% of these people fall to normal levels within a few months after having been infected, although the cellular immunity, the T and B cells, still have that memory of the infection. Do you remember what the CDC
well,
protocol
I think the CDC uses
is?
90 days as kind of a cutoff. If they
90 days?
90 days.
All right,
If they are exposed again within 90 days, they don't need to isolate, they don't need to quarantine, because there is an assumption that they've got immunity that lasts that period of time. They actually don't usually recommend even to be tested, especially because we know that with the standard nasal swab PCR test, that can remain positive for a long time, even somebody who's not actively contagious. So we generally don't recommend to repeat that within 90 days for any reason, but there's an assumption, I think, in the CDC guidance that we can expect that they're probably immune for at least 90 days.
Okay. We started with you, Dr. Jetmore, saying, Dr. Huth saying, there's been a spike. Actually, both of you did. So let's go to your numbers. We normally wait a little bit longer, but I think
Sure.
you want to talk about this a little bit more, and there's some things that you all can get into. So Ryan, if we can bring up the first of his slides and kind
Right,
of
these are
zoom in.
the Reed Hospital numbers. I brought a version that is the actual daily numbers for over the last 4 weeks or so. And we can see that down to right at the end of last month, September the 30th, we had reached kind of a low point. We actually had several days without any patients on ventilator. That's the rightmost bar in each grouping, and we can see that that's 0 for 4 days in a row, September 30th through October the 3rd.
Right.
And the total in isolation have gotten down to 9 or so. But then since then, we've been on kind of a fairly steady march up in all the categories. We're back up to sort of our normal 1 to 2 ventilator patients a day. But probably most worrisome, the numbers in isolation are back up to 25 or so, and we haven't had that since earlier in September. And the known positives hovering around 10 or 11 or so. So, we are seeing an increase, and as we have pointed out on many occasions, this isn't necessarily a reflection of Wayne County, because Reed sees patients from all the counties surrounding, and we often get referrals from other counties, including a couple counties in Ohio fairly frequently. We've taken transfers from the hospital in Greenville, Ohio, or referrals up from the emergency room that Kettering runs in Eaton, Ohio. And so our numbers are not necessarily a reflection of Wayne County, but I think in this case they probably are, because of the changes in the Wayne County numbers that coincide with it, which is the next page, Ryan. And I compiled this graph from data that Christine and her staff provide, just because I've gotten used to doing that. But we can see that we were talking about our concerns back on the week ending September the 5th. These weeks all end on Saturdays, by the way. We had 99 for that week, but then things fell off quite a bit for 3 weeks in a row, and we were very excited and pleased about that. But then the week ended last Saturday was back up to 50, and for the 10th, which is tomorrow, I only have partial data. So this is data through Wednesday the 7th, Sunday to Wednesday, and it was 50 by that time. And we know that there have been almost that many again. I think we're getting close to that many again since then. And
So
I
this
don't
is
know
going to
the
be close to
number exactly.
100.
At least
When we
30
look at this
somewhere.
next
It'll probably
week.
be a little over 100.
So that's very bad news, and I would say it would be maybe less bad news if we were still following the pattern of a lot of younger age cases that we had been doing. But if we look at the last page of the data, I brought back the age groupings for the Wayne County positives, and I almost don't need to say anything, because I think it's pretty obvious that there's a big difference here. And that is that whereas in the previous 3 or 4 months, we've seen increases in the 10 to 30 age-year-old group, and we had mentioned also some increases in the earlier middle-aged group of 40 to 49. But now, since October the 1st, where we have about 116 total cases, 32% of those are above age 80, and another 8% are above age 70, and altogether that's 40% above age 70, which is very high risk. And I didn't bring it back today, but we know that the case fatality rate in those age groups is above 30%. So what this means is that probably around 44, 45 cases in the above age 70, and that's very bothersome because of the high risk of mortality. And if we simply follow the numbers, a matter of statistics, we should expect around 12 to 15 deaths out of that group. And that's not what we want. You know, these are real people, and so it highly troubles me. And I'm not here to point fingers or speculate. I think we do know that it's been in the news. There have been outbreaks in a couple of long-term care facilities, and I know that they're working very hard to contain that, and the health department is working with those facilities. But probably a lot of those cases, but not all of them, come from those outbreaks.
No, we had two major outbreaks in nursing homes. One had four of the people living there and three of the service staff. The other one was a major outbreak with 30-some of the patients being infected. So that, I'm sure, Tom, affected that bar graft. But it doesn't explain it in its entirety. And you're right, it is alarming because of the high risk of these people and the high mortality rate in that age group. So I think it behooves us, if we're a worker in that nursing home, to really be careful of our behavior outside of work. If we're visiting an elderly parent or an aunt or uncle in that nursing home, it really behooves us to watch our behavior outside of the nursing home, because that's how that virus is getting into the nursing home. It's being brought in by the visitors or workers.
Is there any thought as to, beyond the long-term care facilities, what has helped create this spike? Are we getting, you mentioned it's cooling off, and it is. People are beginning to move indoors. Are we losing that containment? Are grandparents watching kids a little bit more as they get home from school? Have you been able to figure out
I see, I go to a store, which will be unnamed, where I buy horse feed, Tom. I buy horse feed and chicken feed there. And for the past month, I never saw anyone in that store without a mask. Then the last time I went, there were 3 or 4 people there that weren't wearing masks. As I said earlier, the movement of this virus is behavior-driven. I think people, when we settled into stage 5 of the governor's plan on controlling COVID, I think a lot of people thought, well, it's over. You know, we've suffered enough. We've sacrificed enough. It's time for us to go to this large group gathering or celebrate. It's groups of people coming together, and I think and they're doing this because of behavior fatigue, I think. People get tired of wearing masks, socially distancing, and being socially isolated. I mean, we're mammals that like to be around mammals of our kind. So I think that's the reason. It's a change in behavior. But it's so important that this is the only tool we have. I mean, we look in our toolbox, we see a mask and a 6-foot measuring tape. I mean, that's the only way we have of controlling the spread of this virus. So people, you know, now we need to redouble our efforts. Now that's not to say we have to shut down our economy. I want to do this to keep our economy going. We can have our cake and eat it. We can do all the things we want to do, but we got to reinvent ourselves. We have to, like Denise was talking about, we can have Halloween, but we have to modify our behavior. We can still do many of these things, but we simply need to mask and social distance ourselves.
Okay. You're watching Ask the Doctors on WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live. We are taking your questions on the WCTV Facebook page. We're also taking your questions on Twitter at WCTV Info. Voice in my head says we have a few more, so let's bring up a couple. Has Reed had to transfer any children to other hospitals for treatment of COVID-19?
I am not aware of any need for that to happen. I guess I can't swear for sure that it hasn't, but I'm not aware of any specific cases. I think I have mentioned previously that we have had one or two children in the hospital very briefly, and I think we were talking in those cases about early teens, and they didn't need to be in the hospital very long. And this all happened much earlier in the timeline. Perhaps I'll find out differently, and I'll come back with that information next week because we want to be as transparent as we can on things. But I'm not aware of the need to transfer a child.
Okay. Let's keep going. Have we learned anything from the Southern Hemisphere that has just completed their winter, which could help us prepare for our winter and how we social distance, etc.?
Well, I think the thing that I've always noticed, because I routinely look at the data from the world, look at curves for different countries and parts of the world, and to try to, because I like to try to fit things into the bigger picture. And the thing that always impressed me about the winter cycle that just ended recently in the Southern Hemisphere was that they had kind of an expected explosion during that time frame. That was when a lot of the southern, like the South American countries, Brazil in particular, had its biggest increases. And early on, when the U.S. was much more affected and Europe, the Southern Hemisphere countries really weren't very much, or as much, most of them. But most of them, especially Brazil, really the largest country population-wise in South America, really had its explosion towards the end of their winter cycle. But at the same time, it seems that they've had a relatively mild flu season, a milder flu season than they were expecting. And the early speculation on that is that it may have been that a lot more people are distancing and masking in that part of the world to try to prevent, coming down with COVID-19, but it actually may have helped reduce the spread of influenza. So those are probably the two things that I noticed about the Southern Hemisphere experience. I admit I have not really looked at more data in several weeks, so if there's more information out there, I'm not aware of it. There could be more, but I think those two things in particular.
You know, the one thing about this virus, Tom, when we talked earlier in the spring, I thought that this would behave more like the traditional flu, that we have a flu season. We were getting our flu shots now. I thought that COVID would diminish as summer came in and of its own because of a COVID flu season. But the virus tends to thrive no matter what the temperature. And right now in India, I mean, COVID's raging.
Right.
It's probably going to catch up with the United States. In terms of learning from the South American experience, I think the more important thing with COVID is if the weather, either hot or cold, causes people to gather inside, either to get by a furnace or to get by an air conditioning unit, that those people in proximity tend to really spread the virus. I think that's the one lesson we've learned, and I think that's why a lot of epidemiologists are anxious about what will happen when the weather really turns cold here in the north.
Yeah, and I think, you look at I try not to do too many comparisons to influenza because we are talking about a very different class of virus. The coronaviruses are not influenza viruses, but what we experienced with, say, the H1N1 virus, the big pandemic that occurred in 2009 to 10, and a lot of people don't remember that. It was a long time ago, and there are enough people who just don't have memory of that. But I was there. We were dealing with it at Reed, and it wasn't anything like what we're having to deal with now. But what happened then was the H1N1 kind of broke out on a worldwide basis in early spring. And in the U.S. was a big factor all through the summer and into the fall. And then as the next flu season came around, the H1N1 piece died off quite a bit. And we had a very mild flu season that following winter. But since then, so we had this big outbreak that was out of phase, not in the same flu season cycle. But ever since then, H1N1 comes back with the normal flu cycle. So it is a portion of the triad or tetrad of virus that is covered in the vaccine, depending on which vaccine you get. And so I think that there are people who think that maybe that's what will happen with COVID-19, is that it will settle down into maybe a wintertime issue, so that the vaccines going forward will have these flu vaccine components and a COVID vaccine component. We'll have to see how that works out.
We've got about 7 minutes left to go. Let's see if we can get through a couple more questions. We do still have them coming in. Are patients being infected from staff whose children are back in schools or other activities?
This is really more of a public health question, but that
I can't think of a specific instance when that's happened, which is not to say it hasn't happened. I wish my executive director was here, Christine Stinson, because she might be able to answer that.
Well, we might hold on to that one and bring it back next week.
We might hold on to that and let Christine take a crack at that one, because
we'll try to get her in here next week.
She's involved with the case tracing more than I am.
Let's go to the next one and put an asterisk next to that one. Has the use of ventilators increased or decreased at Reed as more information has become available about how to treat this virus?
So that's a great question, and the use of ventilators, the placement of ventilators in the therapeutic treatment protocols has changed. Early on, when we first started seeing cases, the typical recommendation was that even when that earlier ventilation, mechanical ventilation, was better for patients. So as soon as they started dropping their oxygen levels, don't wait very long to start mechanical ventilation. But it fairly rapidly became obvious that really didn't help. In fact, it may have been deleterious for various reasons. And so we have kind of flipped that paradigm, and we do better. We do now put off mechanical ventilation as long as we possibly can, try to find other ways to support the oxygenation. And probably the biggest thing that has made the difference to being able to delay and even subvert entirely the need for mechanical ventilation is positioning strategies. That patients will be basically turned frequently so that the different parts of the lung are down, and that opens up the opposite parts. And if you rotate patients who are very sick that way, we can actually get better oxygenation and avoid mechanical ventilation in a lot of cases.
Okay. We've got about 4 minutes left to go. Dr. Jetmore, I'm going to ask you to reach into your pile of papers next to you and pull out the information about flu clinics that you have coming up that Christine was nice enough to give you. We kind of started that earlier.
Yeah.
We want to bring those dates back around, and next week we'll probably have a slide that we can bring up with that.
Yeah, we'll have a slide for you. I got this in the form of an email from Christine about an hour before the show. The Wayne County Department of Health is having 4 flu clinics that are coming up between October 17th and October the 24th. The first clinic will be on October 17th at the Centerville Abington School, and it will take place from 10 in the morning until 1 in the afternoon. The second clinic will be on October the 20th at Western Wayne Schools from 4 in the afternoon till 7 in the evening. The third clinic will be at Hagerstown School Hagerstown Elementary School from 4 in the afternoon until 7. And the fourth and final clinic for the time being will be on October the 24th at Seton High School from 10 in the morning until 1 in the afternoon.
Okay. Thank you for that information. We thank Christine for that information. We know hopefully she's watching or following along on Facebook. Dr. David Jetmore, Wayne County Health Officer, thank you for being here. 27 weeks and counting. Dr. Thomas Huth, Vice President of Medical Affairs at Reed Health, also guest on WHIO's news at 5 p.m. on Wednesday evenings answering COVID questions. If you have not had a COVID test or are thinking about having one, there are a couple of places in Wayne County to do that. We're going to start with the testing site in Cambridge City because that is the newest site that is available. It's 138 West Main Street in Cambridge City. It is open Monday through Friday from 8 a.m. to 8 p.m. Hoosiers will not be charged for testing. If you have health coverage, including Medicare, Medicaid, you can take that information with you. There's a phone number there on the screen. There's also a website. That is the OptumServe site that used to be at the Elder Beerman building. There is still COVID testing at the Elder Beerman building in Richmond. The Wayne County Health Department has taken over doing that site, and you see that information on the screen. 601 East Main Street, 8 a.m. to 6 p.m., and you can register for scheduling to do that. We know that during this time frame, a number of people have lost their jobs, changed their jobs, looking for food assistance. There is available food assistance. You can go to indiana.gov/FSSA to find out some of the local food pantry sites. Also, there is a food pantry every Thursday from 8:30 a.m. to 2:30 p.m. Richmond Community Schools has been putting that on. It is a drive-through food pantry. They ask that you please stay in your vehicle, also wear a mask. We've been talking about things that you can participate in. There's a couple of things. Bike-Tuber-Fest is going on through the 31st. That's actually a fundraiser for Cardinal Greenway. It is their main fundraiser. You can find out more at biketuberfest.com. Also, the 23rd Annual Seton Catholic Cardinal Classic. It's a virtual golf outing. That I got to figure out. That's going on through October 31st. Maybe Ryan can tell me how that's going to work. Ryan is the golfer. How do you virtually golf? And we want to remind you about voting. Please, in-person absentee voting is continuing through October 31st. You can do that in person at the courthouse, in-person absentee voting or early voting as we call it, October 26th through the 31st, 10 a.m. to 7 p.m. at the 4 locations listed there on the screen. And finally, of course, Election Day, November 3rd, more locations where you can go and do that. And we will have a live show here on election night. I'll be joined by Brenda McLean as well as Melissa Vance from the Wayne County Chamber of Commerce, our partner in the In Focus Candidate Forums. Thanks for watching this week's show. We greatly appreciate it. As always, I wish you well. Get out and enjoy the weekend and go vote.